Hello, my name is Dr. Kenneth Rosenstein. I'm a general otolaryngologist practicing here at BeckerENT. So the early warning signs of thyroid cancer really are limited. In general, the vast majority are identified as a neck mass or a neck lump or a nodule that's identified by the patient or the patient's healthcare practitioner. The vast majority of neck masses do end up being benign disease. So although thyroid cancer is identified in this way, we do have to proceed with an investigation to identify that. So how do you know if something's wrong with your thyroid? That question, it's important to understand what the thyroid is for. The thyroid is a gland in the neck that releases thyroid hormone that is essentially the engine that runs your body. It controls your metabolic rate. So if something is wrong with your thyroid, it needs to be evaluated in two ways. So we talk about the function of the thyroid. Are you producing enough hormone? Are you producing too little or too much? That is identified through blood tests and is often done by an endocrinologist, although ear, nose, and throat doctors regularly do this lab work. When we talk about thyroid masses or nodules, those really need to be identified through imaging, an ultrasound. If you have normal thyroid lab work, that does not mean that you do not have a nodule. And if you have a nodule, that does not mean that your thyroid doesn't function appropriately. So you need to evaluate the function and the architecture of the thyroid gland to have a comprehensive assessment. The most common thyroid disorder by far is hypothyroidism. Hypothyroidism simply means that the gland does not produce an adequate level of thyroid hormone to keep the body running at its optimal metabolic rate. The condition often does not have an explanation or an underlying condition that promoted it. It essentially is a gland that has petered out and is just not working as well. It's much more common in women, although it is found in both genders in significant proportion. Early warning signs of thyroid problems is dependent on what that problem is. So knowing that thyroid hormone is sort of the gas that runs the engine of your body and really sort of marks your metabolic rate and where you should be operating from, then that's easy to sort of then discuss the symptoms. So if your thyroid hormone falls too low, you'll have all the symptoms of everything slowing down. So people will have weight gain. They will tend to feel cold even in warm environments. Women often will report hair loss, changes in their skin texture with some dryness, a feeling of bloating. The gut slows down, constipation is more often. So it's essentially just a very sluggish metabolism. If that changes fairly quickly over time, we would generally do lab work to rule out hypothyroidism. That's the most common condition. Hyperthyroidism is the opposite. It's definitely less likely, but we will see a speediness to the person. It can increase anxiety. It can increase their volatility with mood disturbances. High blood pressure can certainly be an issue, and because of that, they will get headaches and excessive sweating and periods of a fast heart rate. They tend to have weight loss despite eating an adequate amount. So those are really the two hallmarks of a thyroid hormone dysfunction. Thyroid cancer is generally a very treatable condition. There are four main types of thyroid cancer, the most common representing 70 to 80% of patients. This condition, papillary thyroid cancer, typically will present as a neck mass. 95 to 99% of people are curable with surgery. They often do not need chemotherapy or radiation therapy or any of the things that are often associated with cancer treatment. We sometimes use a molecule called radioactive iodine as an injectable medicine, which is very well tolerated with very minimum side effects. So following surgery, we certainly surveil the patient over time with imaging. However, their rate of recurrence remains very low throughout their lifetime. Thanks for listening to our responses to these very common questions. If you have any other questions or anything that comes up, we're happy to see you here in the office, so just come on in.